Welcome to the Triple D Podcast, Donuts, Disability, and Discourse, where host Michael Leiner talks to the best in the business about community, impact, business, and donuts. Here's your host, Michael Leiner.
Welcome back.
Hello.
This is another episode of the Triple D Podcast, Disability, Donuts, and Discourse. I've got an excellent guest this week, Dr. Todd Hochman.
Thank you.
Thank you for coming and hanging out with me today. Here,
My pleasure.
We're right in our neck of the woods here at Davis Bakery on Chagrin Boulevard, and are we in Beechwood or are we in Woodmere?
Woodmere. This is Woodmere.
Yeah. Wait, where did you grow up? You grew up pretty close to here,
Right
didn't
behind here, Orange. Yep. Yeah, we used to cut through these streets, get down here. This has been here forever, man.
So you used to run here barefoot when you were a kid.
Exactly.
To the bakery. Was Davis Bakery here when you were a kid?
Davis Bakery.
I know they had a
been
ton
here
of locations.
It's been here forever.
Yeah.
Since the early 80s, at
Yeah.
least.
But I never remember it being as busy as it has been lately. Like, the line outside is crazy.
Food's great, man.
The food is great. Well, I'm excited to have you on here because, we've had a lot of lawyers on here. I think we maybe have had a doctor too, but you're someone who I like talking to because of just how natural the conversation always is with you. And you're a real genuine dude like me. Tell us your niche. What type of medicine do you practice?
So my practice is I was board certified, went to residency for internal medicine and pediatrics, and in the training started to do some occupational medicine and really found it to be a very interesting area. And so I started to take take to it due to the patients, the issues you were dealing with, the pain, the distress that you could help people with. And it just is something that has evolved into a practice over the past 20 years now.
Yeah. Did you always want to be a doctor?
Yes, in a way. Of course, my Jewish mother always wanted me to be a doctor. But, honestly...
I met your Jewish mother.
Did you?
Yeah, at Park
that's
Family
right.
Day.
That's right. That's right. She's one of a kind. She's the best.
In case she's watching.
Yeah.
You're the best.
But no, honestly, it was an area of interest. When I was younger, my grandmother was diagnosed with cancer when I was literally right before I was born. So we spent first 9 years of my life in and out of Mount Sinai Hospital.
Wow.
And so that was really probably, kind of what laid the groundwork. And then my grandfather, my junior year, came back from California and was in hospice care in our house. And so it was an area of an interest, and it's something that really, the whole medical side of it took to my heart. And, it just kind of went down that path. And
Yeah. And you told us, the background that you have in medicine. So what do you, tell us about your practice now. What do you focus on?
So I have two practices. I have one on the east side of Cleveland, right here down the corner in Beechwood, and the other is on the west side. My practices are primarily occupational medicine practices, so a focus in work-related injuries. And then I also deal with other medical legal issues that come up as well.
Okay. So you're working with a lot of clients who were, going through the Bureau of Workers' Compensation system and...
Yes.
What's that like? I mean, because people come to you a different way than they go to a lot of other doctors. There's always an injury. They're hurt.
The medicine is the easy part of it.
Yeah.
There's a lot of physicians in the area that just don't want to get involved with it because there's layers and layers of bureaucracy and struggles to get the patients the care they need to try to get them, their benefits set up in place. It's never without obstacle. So it's really trying to navigate a system to figure out how you can get that injured individual the care they need in a timely manner and get them back to work as soon as possible.
And, I mean, when you talk about the layers of bureaucracy, what does that mean?
So in the workers' compensation system, it is you have the injured worker,
Yeah.
and that's who we are treating. That you're dealing with a managed care organization or insurance company there's many of them in the state of Ohio. They're usually picked by the employer. So you're dealing with them. There's then another layer where you're dealing with the Bureau of Workers' Compensation. everything that needs to get approved as far as a treatment, a condition, has to go through multiple layers. It has to go clear the bureau system. If it doesn't clear the bureau system, there's hearings on that. If it clears that, then the employer has the opportunity to potentially, disagree with the decisions and appeal. So there's a lot of delay, which really leads to a lot of patient frustration, and it leads to a lot of physician frustration. It's one of the reasons I chose this area, or decided to partake, is a lot of us don't want to do it.
Do you see a circumstance? I mean, you mentioned the frustration that they feel with the delay, but doesn't that also oftentimes cause their injuries to get worse? While they should be getting the care that they need, they're fighting over who should be paying for it, and the person's just suffering that whole time.
Yes, yes is the answer. I mean, anytime you have definitely a surgical injury, usually the time is ticking in most cases, and the longer you have to wait, the more pain and suffering you go through while you're waiting, and then the less likely you're going to have a good outcome at the time of surgery, and the longer the recovery. So
it's interesting because there's like so many parallels when we talk about this, that I think between you and how you have to like wait to do the procedures that that your client needs, and what we're doing in my office, where we'll put together a client's disability application, we'll make sure that we have the medical records together, but then we're just stuck waiting for somebody else to do what they're supposed to be doing, but we become the ire of the clients. How come my case is taking so long? Why was I denied? And do you feel that way? I mean, do you get patients coming to you like?
I think most of them are very appreciative. I think we
Can
have
we just
developed,
switch jobs?
we have developed a system in the office that, yes, there are some frustrations. Obviously, we need to get through our hurdles as a staff and get to the people we need to get to, but generally we are focused on getting results, and that's our big thing. So it's frustrating, but yet I think the patient, it's interesting. If you have high blood pressure and you come to me and I give you a medicine that makes you go to the bathroom every 5 minutes, but you get 10 years at the end of your life, every time you go to the bathroom, you're not saying, "Thanks, doc." You're kind of like, same with diabetes. If we tell you, "Hey, don't eat sugar," exercise, things we don't necessarily want to hear as people.
Yeah.
So in doing what I do, when you're dealing with people that are in pain, and you can help fix that pain and help that pain get better, and you're helping them to get through a financial situation that's stressful, but you're working on their behalf to try to get them to that point, I think there's a real appreciation, and and sometimes more immediate. I mean, if you can make someone's pain go down significantly while they're waiting for this, I mean, it's an immediate.
Do people come to you most? I mean, is pain the common denominator among what you're treating, or is it a whole constellation of symptoms?
It's a whole constellation. I mean, pain is usually associated with the injury and the inciting event. Obviously, pain levels wane. Some people develop chronic pain syndrome. Some people's pain, goes down. Then there's also a whole level of psychological distress, when they're going through these type of situations. I mean, the fact that they can't go do what they were doing every day. They can't go to work. They can't, get the mail. They can't go to the grocery. There's a psychological component to many of these patients.
Yeah. How did you get into this particular type of medicine? You said that
I did a month with during my residency, and it was just somewhere that I just took a liking to. I saw a need. I saw patients that really needed help, and the more you start to do it, the more you start to understand the systems that are in place and how to help people navigate through that system. I think you start to see results, and when you start to see results and you start to see patient results, it really drives you to continue to try to be better.
And like in Northeast Ohio, and I can't pretend that I know like every doctor that's out there, but your name is floated as the best at what you do in terms of occupational medicine. What were the steps to get to that point? I mean, did because it's just kind of a niche area that people don't want, did it kind of happen for you overnight, or was it a slow progression?
Nothing happens overnight, and I think like everything, it's hard work, right? It's figuring out what you need to do. I mean, when I started, it was I was green. I was trying to figure out, Which, I mean, in my world, there's a form for everything. There's Medco 14s, there's C84s, there's Medco 31, C9, C11. I mean, there's just so many different
all
forms.
the numbers and letters.
Yeah, they put them all together.
You got them all.
And how to navigate through those, and how to get, when you start to understand a situation and you work through it, you start to understand. You start the next time that presents itself. You start, and it's also never being satisfied, right? Always understand that. Listen, my interest is my patient, and my interest is getting the patient what they need and doing what I need to do and pushing for that.
Did you open your own practice right away, or were you like working with another doctor?
I worked with another doctor for a little bit, and January 2005, just said, you know what, it's time to go. Let's see how this works. And I had a general understanding. I had no idea how it would work or where it would end up, but we just went into it and figured it out.
How long were you working with that other doctor for?
Less than a year. It was pretty. I started there, and I still did a little bit of work in the office, but it was pretty much. I was ready to go. I wanted to be on my own.
So, and I know what my work life is like now, which at this point, just with the growth that's happened in our practice, I spend way more of my time managing, the people, managing the practice than I actually am being a lawyer. In the medical world, how does that translate? I mean, do you feel like you have to spend a lot of your time being like the CEO of a business as opposed to being a doctor, or how does that break down for you?
I enjoy being the doctor. I think, from a family perspective, it would be nice to put other people in place and do the managing and be able to get home earlier and have more family dinners and be at more kids' events. But I enjoy being in that room with that patient. I feel that I feel seeing them, understanding the situation, looking at what's going on, it really helps me get them from point A to point B. So I spend, in my practice, pretty much from 7:30 in the morning in the office till probably 7:38 Monday through Thursday, and then that's strictly seeing patients. I mean, there's no lunch. It's just patients, and at the end of the day, it's messages, getting through the paperwork, dealing with all the other issues that come up in the office, as you're aware, other people's issues, and then trying to fit everything in and around it.
I'm remembering because you just mentioned how like there's no lunch, and I know that you kind of have a strange diet, which is you don't eat.
Well,
you told me about those blue zones.
Yeah,
Did you see that documentary on Netflix?
I have not seen the documentary, but I've done my research and read about it.
Did you know that they just came out with a whole documentary on blue?
I'm not
It's like
surprised.
a docu-series. It's one of the top things on Netflix right now about it.
It's ingenious. I mean, the guy who did it was, I think it was Dan Buettner, if I'm correct. It was just simply a journalist who went out in the world and identified 5 civilizations, I believe, that lived the longest, and then retrospectively analyzed them to see what they have in common, and created the Blue Zone lifestyle. And it's thousands of years of data, if you will.
What is it? For people who don't know, what is the Blue Zone lifestyle?
It's just the Blue Zone lifestyle. It talks about, again, there's diet. For one, in diet, the Blue Zone diet, no meat at all. Fish is a plus or minus. It's really a lot of your proteins, beans. It's a very Mediterranean, based approach. Exercise. It doesn't have to be physical exercise. It's people walking to work, doing their yard work, just staying active. Interesting, moderate amounts of alcohol was shown to be a positive in most of the civilizations. Close community work, just things that I guess in retrospect are kind of common sense that we know. But so it's an interesting thing.
Do you teach your patients any of this, or I mean, it's a little bit different than what people are coming to you for? But.
We talk about it when the time presents, but it's there are so many issues to be had in the visit, about what we're doing, how we got to get, where we are in the process. Usually when they're in the office, there are 2, 3, 4, 5 issues of sometimes contention. Sometimes you're just trying to figure out how are we going to get from point A to point B. Whose records do we need? What forms do we need that we don't have the time to go through
Sure.
that. But if it comes, well, when people are working on weight reduction and things of that sort, we do bring it up. And
So I want to go back to like you were talking about the bureaucracy in the system and how it creates frustration. If you were to really try and think and analyze like where are the problems, what would you like to see done different that would just help patients get better quicker, what would it be?
the answer is simple. I don't know how it's done. It's treat them.
Yeah.
Treat them and get them better and get them on their way. I mean, like you said, if you just look at it with a rotator cuff tear, right? With a rotator cuff tear, from the day you have that tear, if it's a full thickness tear and surgery is needed, it's needed, right? So
Yeah.
day 1, you need it. Day, 10, you need it, and if you're in our world living with this, nobody wants to sit around and wait to begin the real recovery process. Month 6 and you're still waiting for the surgery, that's a problem, because now you're going to operate on a condition that is going to it may not get back to the same level, and the recovery process is going to take longer. So it's just speeding up that care.
In like a non-emergent, non-life-threatening type situation, is that like a common timeline where, if you or I were to go out and, throw some baseballs with our sons and tear our shoulder, we're getting operated on pretty quick once we've made that first appointment, gotten diagnosed. Our insurance isn't probably going to fight that. How long, medicine better than me, maybe in a month we're getting things taken care of?
Hopefully sooner.
Yeah.
Hopefully, it really depends on access.
Yeah.
I mean, I broke my collarbone playing Thanksgiving football with the kids. First bowl,
Really?
turkey bowl in the neighborhood. Yeah, a bunch of 6 and 8 year olds beat me up. But and
it tells me a lot about you.
Yeah, there you go. But I had surgery 2 days later. Thankfully I had the ability to get to the people I needed to get to. But I can't imagine had I had to wait another 3 months to start that whole recovery process. I mean and that was a reality check for what these guys are going through.
So has that changed how you approach your job every day at all, or does it just make you more motivated to help?
I don't think it's changed anything, because I've always had that motivation, always tried to push, to move this forward as quickly as we can. I think it really made me understand the psychological perspective when you don't get it, and how that can really affect people, and really how pain affects people, right? I mean, nobody can understand in your world, dealing with disability, nobody can understand how a foot can prevent you from doing a lot of things. But
Right.
until that you live in that pain, and that pain takes over your world, you really we forget. Thankfully, but going through that experience really had me an appreciation for what these guys are going through.
It's, just thinking about, and I talk about it a lot in different forums, but, I get cluster headaches, and they don't come very often. They come usually every 3 years. But the first time I ever went through a cluster period was the week after I started my own firm. And I remember needing to be picked up in the middle of the worst part of Cleveland, because I literally thought I was having a brain aneurysm or something. I thought I was about to die. But if I didn't happen to be self-employed, and in a circumstance where thankfully the treatment that they give for it takes a while, but it works, I would have had to have closed down my practice. If I was employed by somebody else, I would have been fired because of how unreliable I would have been for a period of time. And that's the reality of what it is for my clients, for so many of your patients, is they're just hanging by a thread trying to get this help that they need that they can't get. And it definitely changes my approach every day.
It's frustrating. It's sad. I mean, I think it like I said, that's part of why I do what I do. And I think, when you meet real people that are there and really need that help, and that's what I'm talking about, the diabetes and the high blood pressure. Those aren't emergent things. I mean, they're emergent, don't get me wrong, but you don't see those effects right away, usually, unless they're, in a hypertensive urgency or their blood sugars are crazy out of control. But when you see people that come in that can't work,
Yeah.
don't have a paycheck, can't get the treatment they need. I mean, they're at the end of a plank, and you're trying to help, put a bridge under them and try to get them to walk across and hopefully get back to where they're. So it really does get.
Are there any negative stigmas that you feel like you face in the type of medicine that you practice?
Of course. I mean, it's a controversial area of medicine, right? I mean, it's, like you said, you have a rotator cuff tear, you go, you get the MRI, you get the surgery, you finish, you do what you do,
Yeah.
In this world, honestly, there are, like I said, you're dealing with an injured worker who has a managed care organization, who has a employer, who has, then the BWC, and then, there are insurance premiums, that are affected based on, injuries and whether, people, how long they're off work and things of that sort. So yeah, it gets very, very contentious. And so, yes, I mean, and I stay in the room, I stay focused on the patient, doing what's best for them, and know that I go home to my family and do what's best for them, and, try not to worry about the rest of it.
How do you find kind of a balance? I mean, you talked about your work life, which is demanding as can be, but you have 2 kids who are in the same grades as my 2 kids. What's that like for you?
You know what? It's why you do what you do every day, right?
Yeah.
I mean, it's not just, helping the patient but we also go to work for a job. And you know what? I go to work and I enjoy what I do, but I live to come home, and see them and be with them. And, I'm not there much on weekdays, but, from Thursday night, Friday morning till the day till Monday morning, I try to be there. For them in the morning to get them off to school and do as much as I can. But
do they ask you about your job?
No. I mean, and part of it is probably because I'm doing it there too. Like, it's not as if I am, work follows you.
Yeah.
This isn't, patients may not follow you, but as I alluded to, there's tons of paperwork, And then you're dealing with, it's not just, it's all the paperwork within the workers' comp system, but then, a lot of patients that end up having severe injuries end up on disability, and then there's the disability forms that need to be completed for patients. There's returning phone calls, there's reports, there's just a whole, that stuff comes home. So like Monday through Thursday, I'm there with the patient, dealing with the patient, but then there's all the other stuff that needs to get. So usually when I'm at home, I'm surrounded by the kids and paperwork and trying to balance between them.
When you ask your kids what they want to be when they grow up, do they ever say they want to be a doctor?
No, right now they're just feeling out life.
Yeah.
I don't think, they're busy playing, busy having fun.
Yeah. Well, it's always fun chatting with you. I'm so glad that you gave up some of your time. I know you're busy to come and hang out with us, but we end every episode with a tasting. Typically, we're in the presence of a donut, but here at Davis Bakery, a Jewish bakery, I thought we'd go with a more traditional pecan roll, something that would appear at Rosh Hashanah at my house from time to time. So I know this might be outside of your blue zones, but will you have a little bit of a nosh with me and just tell us what you think?
Certainly.
Here we go. I'm going to cut us each a little piece. You can grab at that. We'll do a cheers. Oh, he's manicuring this. He knows he can only afford to eat one bite today. Here we go. That's good.
Very good. Highly recommended.
Yeah.
It doesn't have nuts, does it?
Uh-oh. Cut the tape. Cut the tape. Thank you for being here,
Thanks,
Dr.
man.
Hochman.
Appreciate it.
My hands are all sticky.
Yeah, that's all right. Anytime.
Thanks for listening to the Triple D Podcast, Donuts, Disability, and Discourse. Rate, subscribe, and tune in next week for more discourse and donuts.